Hello, I'm Dr. June Andrews Horowitz from the University of Massachusetts, Dartmouth, College of Nursing and Health Sciences. I'd like to talk about the International Family Nursing Association and our conference that was held in person in Dublin, Ireland, June 2023. And at that conference, I was honored to receive the Excellence in Family Nursing Award for 2023. And this is an award that recognizes a nurse for international contributions to family health. And in my case, particularly for contributions to perinatal mental health concerning postpartum depression and the health of mothers who are experiencing postpartum depression and their infants. I also transitioned in my role from president-elect to president at the end of this conference. In relation to both the award and my new office as president, I am honored, humbled, and totally thrilled. During the award ceremony, I was brought to tears by hearing the kind words of the awards committee and my nominators that I was selected for this award. In relation to the award, I'd like to do a shout out thank you to many people, but I'll keep it brief and focus on the two people who nominated me, Dr. Helene Moriarty from Villanova University and Dr. Kathy Knaffel from the University of North Carolina, Chapel Hill. These two internationally recognized family scientists honored me tremendously by their willingness and their friendship and colleagueship for decades. I also appreciate all the influence that I've had from various teachers, colleagues, students, and also participants in the various research studies that I've done, mothers and their infants, to promote family health. Next, I'd like to talk a bit about what benefits I think there are to the College of Nursing and Health Sciences at Umass Dartmouth by my involvement and the involvement of other faculty and some of our graduate students in IFNA. I think there are many. I'll highlight those that I think are most important, starting with the spotlight that my role as president brings to UMass Dartmouth and the College of Nursing and Health Sciences. Our college's name and logo are listed on all of the materials in our website for sponsors for the prior conference, and my involvement at UMass Dartmouth is listed along with my role as president for all the materials that go out related to IFNA. I think that takes UMass Dartmouth and College of Nursing and Health Sciences out of our little corner in southeastern Massachusetts and brings us to a national and even global stage, along with many other top universities and health science centers and healthcare institutions. Secondly, it helps us make our aspiration to be a leader in global health a reality. It gives us a concrete opportunity to network, connect, and examine local to global kinds of problems that we think about with global health. It brings a family lens to how we understand healthcare and education and research. It enables and helps faculty and students to move from an individual, narrow kind of focus on health, illness, and health promotion to a family perspective. The family is the nexus of care for individuals also. People don't live in isolation. They live within family structures and networks. And to understand how a health challenge to one member of the family causes everybody in the family to feel pain and distress. That if we only focus on individuals, we are missing an important aspect of our treatment and our research. And we need to educate our students in that way as well. In particular, connections to an organization like IFNA enable our faculty and graduate students to have a network that's international. IFNA has a culture of helping, mentoring newer researchers and educators and clinicians. So our faculty who join and our graduate students who get engaged are able to reach out and make links quite easily to people from around the world who are experts in various aspects of family health and family nursing. I think that is a tremendous opportunity and advantage to UMass and College of Nursing and Health Sciences. I know that I have learned a tremendous amount from my colleagues. It is a privilege to be on board meetings and committee meetings with people from as far away as Japan, Australia, South Africa, Europe, UK, Ireland, Canada, the United States, all at the same time, and to learn from them and to understand what it really means to have cultural sensitivity and cultural humility, that we don't know everything in the United States. I certainly don't know everything, and I learn every time I have the opportunity to engage with a colleague from another part of the world. So in sum, I would say our connections to IFNA are highly valuable and an awful lot of fun. Now I'd like to talk a little bit about how I envision some of the goals and challenges during the time that I will be president of IFNA from 2023 to 2025. There are many goals, along with challenges and opportunities, that a role like being president of an international nursing organization bring. Among the goals that I see for the next 2 years is first to nurture the next generation of family nurses. That includes researchers, educators, practitioners, and those who contribute to policy. It's time that we learn to pass the baton and help those who will be coming after us to take up the cause and engage in international collaboration and knowledge development in family science. Another goal is to increase the reach of IFNA globally. While we have members in all parts of the world and we span all of the time zones internationally, which makes setting up meetings an incredible challenge, but fun at the same time, that I would like to increase our foothold in the countries where we don't have members and to strengthen our engagement in countries where we only have a small number of members, so that we can increase our reach and our impact and our contributions internationally. And another goal that I would like to mention is to increase our international interprofessional collaboration. People often ask, well, who can join IFNA? Well, nurses can join as well as student nurses. But it is also possible for people who are engaged in family health, family science, to join IFNA. And I would like to increase that invitation to our collaborators outside of nursing, because I think it enriches all of us. It creates more opportunities for interprofessional education and research and collaboration. So there are many challenges to come. The world is a complex place, but I'm very pleased that I'm able to make some contributions regarding international family health. Thank you.